Well, good morning, everybody. My name is Mark Emberton. I'm Dean of the Faculty of Medical Sciences. I'm also a practicing surgeon, so I'm a urologist, and was made aware actually the other day that every operation I do consumes 800 kilograms of carbon. And that's the average. And it's largely due to single-use items being made usually in China and other countries a long, long way away, being flown over, being used, then being thrown away, and then incinerated. And it's just quite interesting now to reflect on that. So when I started training as a surgeon, we were using items that could be washed and used again, like gowns. And we were using instruments that were put in cleaned and sterilized and reused. And all that, of course, has kind of gone away with the kind of the ease of being able to throw away a plastic gown, essentially, and instruments, very elaborate instruments. A biopsy gun has a plastic casing and looks like a gun, and we just use it once and then throw it away. So this is an extraordinary wake-up call, I think, to all of us. And I'm very, very grateful to Anne for her diligent kind of effort and energy and the degree she cares about these issues, which are, as we are all aware, are critically important for the survival of this race. Now, we have to make a difference. So the meeting is just the beginning. I was involved in a meeting about 7 or 8 years ago looking at sustainable healthcare. It was a little bit ahead of its time, but we all left the meeting, really charged with energy and actions, but not too much happened, right? And that's really important that doesn't happen this time. So this is a meeting which will be the kind of the beginning of many meetings and many, many actions that will develop. And I suppose my other reflection is that just listening to some of the dialogue coming out of COP, and there's been a lot of messaging, and some of the messaging was that individual actions don't really make much difference in terms of the impact on the $100 trillion challenge that we have between now and 2050. And actually, it requires governments to legislate and carbon to be taxed, etc. I'm not sure I agree with that. I think every action leads to somebody else reflecting that you did that action. If you choose a vegetarian or vegan meal, the person next to you will be forced to think. If you put solar panels on your house, your neighbor is forced to think about it, etc., etc. And little actions in theatre, just thinking, how can I use fewer gloves, fewer gowns, without putting the patient at any risk, of course. How can I work with industry to develop instruments that are not disposable, that can be cleaned and reused, are hugely important, because that will encourage further conversations. So I think every little decision that we make matters, and I think every little decision that we make will amplify. And of course, governments need to do huge, huge, huge things, but that doesn't absolve us from our duty, particularly in science, the labs. We'll hear more about that now, but also in the hospitals, where there is huge waste that has just developed over time, which we need to correct. So I'm hugely looking forward to today. Thank you to all of you for the time and efforts you've put into this really important area. I'll now hand over to Anne, and once again thank her for driving this agenda.
Thank you very much. So I just wanted to start with these pictures. We've all seen and we're all familiar with the effect of unsustainable practices. This one we're a bit less familiar with, and that's the one that really concerns me the most, because I may feel that I don't really live in a country that's currently suffering from heat waves or from terrible pollution from burning forests and other things. But I certainly live in a country where quite a lot of people are suffering from breathing difficulties and other diseases which are due to or unsustainable practices. There's been quite a few lawsuits in the past 10 years which are accusing local governments and other groups of lacking in their duty of care to making sure that the air children breathe is suitable. And we've seen an increase in respiratory diseases across a lot of the most developed countries. So that was kind of my drive is this, maybe more than that. However, they are so closely linked that we cannot think but one without thinking but the other. And I kind of come to this from an engineering background because I'm an engineer. And I know that a lot of people expect the engineers, the technology to solve the problems. And so I kind of think, how do we develop a responsible healthcare? Technology can do something, but we need people to be involved and really invested in this, understanding that it's for very selfishly all around good, as well as the good of the planet as a whole. And if we realize that we're motivated by our own self-preservation, I think we get a lot more out of everyone. So here is the agenda for this morning. We're going to hear from Nick Watts, who's going to join us from COP26 in Glasgow. Before that, I've just got a few more slides to show you, but I just wanted to reassure you that I wasn't going to be the only person talking. I'm a data-driven person, so I'm going to show a few slides that are data-driven, and then we're going to hear from a host of different speakers whom I'm really glad everybody was able to make the time and join us here. And this is going to show us what everyone across UCL, the different initiatives, and it's got contributions from students, from lecturers, from all professional support services, and really, really glad that we have Aliza Ayaz as well with us, who will speak to you in about 20 minutes. So I want to introduce everybody, listing the names of everyone. I'd like, however, before I go on to the slightly data-driven, a bit annoying slides, I'd like to thank two people who have helped me hugely in preparing this. In fact, I can say that without them, this just wouldn't happen. Catherine Knapp is here, and Deanna Threed, I think, is at the back. I've never seen you face to face in real time, so thank you. Nice to meet you. Thank you both very much. Without your input, we wouldn't be here. So that's quite straightforward. Now we're going to move on to why sustainability matters. And these are, I'm going to have to show that then. This is what really concerns me. This is data driven. This is from The Guardian, by the way. I'll just give you my source. This is what is expected to happen in less than 10 years' time if we are on target with our current policies. We're going to have an increase, this famous 1.5 degrees, and we're experiencing half as many heat waves. So if you think, well, none of these red dots matter to me because I don't live there, I don't have family there, I don't have friends there, well, you start realizing that most of these red areas become unlivable. So if you're neither concerned for yourself, your friends or family from these regions, but if you're concerned because immigration is unsustainable, as some people already want us to believe today, then you've got to think about what happens when this is going on. And you can look a little bit further in time, and at 2 degrees, most of these countries, but also what we tend to think about sort of more intensely populated countries, are starting to become unlivable. This is no longer something that just matters in a few countries. Anybody concerned with the state of some of the most populated countries in the world are starting to see the impact. Well, let's look at Europe, because we all can say, still, it's not me, I have no family there, I have no friends there, I don't care. Well, that's Europe. In around 2030, in the next decade, there will be wildfire risks. Anyone who has friends, family, or holidayed in Spain has already seen them. We've seen the impact that this has had on the local population, and we're going to see this coming up to us. By the way, everything that's hatched, it's not safe, it's just data didn't agree. The Guardian looked at 4 different models, and when there was only 2 or less that were in agreement with one another, they just published it as hatched. So most of it, it's either getting hotter or we're not sure. There's no way that's getting better. It's not just water, it's not just fire that matters, it's also water, because we're seeing an increased impact of rainfall, heavier rainfall, and that is something we can all relate to. Anyone who's lived in London or anywhere in the UK in the past 5 years has at some point or other been affected by floodings of the tube stations, flooding of the train lines, flooding of the train stations, flooding of hospitals, floodings of schools. You name it, somewhere has been flooded. In the UK, it's happening right now. So this is me getting excited. I just stepped back, calm down. It's really happening, and this is looking at in the next 10 years or less. Yeah, we're gonna have some problems there. So what if we change now? That's my last slide. I'll stop there and then I'll be ready to hand over. Sorry. This is a projection that was made in 2018, and I'm not going to try to explain it in too much details, but simply saying that in 2010, when the first promises were made of changing our behaviors and our practices, somebody made this model and they looked at 4 different changes of practices, whether we adopt a low greenhouse gas power production with or without different baselines that they were choosing. So they were saying basically our models are what they are, we're not really sure. What you can see is whatever model they chose, whether it included still some nuclear power, whether it didn't, for the next 30, 40 years, depending on when you start, there was an increase in the number of life years lost per year due purely to microparticles, so the concentration of one type of gas only. They didn't try to be comprehensive. They said, let's look at one gas that we have modeled for long enough. This is what happens if we do something. It takes 40 years to get better. And that was 10 years ago. So we have to think about the fact that we may not feel that it's that urgent. People don't understand why we have to rush now, why we have to make changes to our life and our comfortable way of life or practices now. It's because of this. That's if people made changes and it would already take so long. Obviously, after that, we reap the rewards. Whatever we do, if we change our practices, this is brilliant. There is a clear amelioration in the quality of life of the people who are suffering from this. So I've again given you sources. The Lancet for the past few years have been published countdown reports, 2018, 2020, they published one in 2021. And this year they also worked on a specific report for Europe, which I think is something that's kind of an eye-opener for a lot of people who have been denying so far the fact that there was a problem. It's looking at the data for Europe and showing that the Guardian data that I showed you are taken from there. So to conclude, and I know that somebody else is going to be showing this picture because it speaks a lot. So I got it from the Climate and Health website. It shows you that, of course, we can always say, well, most of the impact of climate change on human health is nothing that really concerns us. Most people think, oh, malaria, you know, this sort of things, cholera. I'm an engineer, so I'm not going to start even to pronounce some of the names of these diseases. But what we don't see is respiratory allergies, asthma, cardiovascular diseases. These are things that are going to happen to us in our countries. It's already happening. People are already suffering. I was born in the 70s, and in the 80s in France, there was a heat wave that killed hundreds of people. We heard about it. It was something that my government, Belgium, my country, suffered a little bit from, but everybody looked at France and said, how could this happen? How was it possible that people died from a heat wave? And a few years later, it happened again. People didn't understand what was going on. There was still a similar heat wave and another wave of death. This was in the 80s and 90s. This is 25, 30, 40 years ago, and we were already aware of the fact that heat waves, unexpectedly high temperatures, caused death and disease and discomfort to people in our countries. And I'm still here getting excited 30 years later, which is wrong.
Hi, everyone. My name is Nick. I'm the Chief Sustainability Officer for the NHS. I'm up in Glasgow. You can tell I'm in Glasgow because it is raining. And it is very cold, and by the time 15 minutes have elapsed, I will be wet and wishing I hadn't come outside to do this. I started at the NHS about 12 months ago. I'm very new there. It's a very special kind of bureaucracy. You'll be pleased to know that it makes UCL look incredibly efficient. I was at UCL for quite a few years at the Institute of Global Health before moving to the NHS. Listen, we're talking about healthcare. We're talking about the role of healthcare in the response to climate change, right? And that is either in adaptation or it is in mitigation. There are many, many, many things that you can do. Depends greatly on the kind of healthcare you're talking about, on the country that you are coming from as you talk about it. The perspective I have is for the NHS. So it's healthcare in this country. It's high income. We've had a decent crack at it. We've had about 12 years working to reduce the emissions of the NHS following the Climate Change Act 2008. Really done some impressive things. And this is an Australian saying this about the English and the British. So, you know, you can believe some of that. Really done some impressive things. It hit a bit of an inflection point last year. Last year, the NHS actually came to UCL and said, listen, we understand that the climate crisis is a health crisis. What are we going to do about it? And so I suppose I could maybe spend a little bit of time talking about that story, about the why the NHS came to UCL, the what UCL did to help, to respond, and then now the how. What is it that the NHS is doing to respond to that climate crisis? So the why is very, very simple. And everyone on this call, everyone in the room should really understand this at your heart, right? The climate crisis is a health crisis. It threatens to undermine the last 50 years, 50 years of gains we have made in health right the way around the world. The core purpose of the NHS, the world's first universal healthcare system, the core purpose, as it was stated in 1948, to deliver high quality care for all now and for future generations. Unless the NHS responds to climate change, unless it adapts, unless it mitigates, it simply cannot continue to do its core purpose. It won't be able to. Climate change is too big, too scary, moving too fast. That's one part of the why. The other part is, listen, we're a part of the problem. We are 5% of national emissions. The total emissions of the NHS, it roughly corresponds to the entirety of the emissions of the country of Denmark or of Croatia. We are 40% of public sector emissions. We consume, I think, 36% of public sector electricity power. The NHS is big. We know we're a big part of that problem. And so we want to do something about it, because most of us are pretty good healthcare professionals who at some point in first year of med school and then the entire way up to being senior doctors, someone shouted at us, primum non nocere, first do no harm. That's the why. The NHS came to UCL and said, listen, we want to take this seriously. We said, we think you're actually doing a very good job. And they said, no. The climate crisis is a health crisis. We want to really step this up. And so over the course of 2020, working with the Institute for Global Health, working with the Bartlett, working with people across the Lancet Countdown, overseas as well, we developed together with UCL and NHS, the world's first net zero strategy for a national healthcare system. Came out 12 months ago, net zero by 2040 for the emissions that the NHS controls directly, what we call scope 1 and 2, and a few other things we throw in there for the fun of it. But we're good health professionals, say it again. We understand that healthcare doesn't start or stop within the four walls of a hospital or a clinic. And so we are taking account of the emissions globally, our entire carbon footprint, no matter where it's come from, no matter whose supply chain. We have a role in it, then we're going to take responsibility for it. And so net zero by 2045. It's a little harder, so you give yourself a little bit more time. It's a little more distributed. You don't quite have levers you can just pull on and suddenly it goes away. Those are the two targets that we have. We have near-term targets as well, because listen, 2040 is a little way away, 2045 is a little way away. So we have 80% reduction targets, 2028, and that is soon. That's in a couple of years. It's so soon that it makes me feel uncomfortable. It makes our chief executive feel uncomfortable, makes our entire team feel uncomfortable. And that's how you know that you're moving fast enough. When you've got just as far as you can go, you're just as ambitious as you possibly can, and you're just pushing the limits of what is feasible, and it makes you feel uncomfortable. That's where we're sitting right about now. So that was 12 months ago. I was tricked. I left UCL, accidentally ended up at the NHS, showed up in October, and we've had 12 months working on this kind of stuff. It's been pretty exceptional. Again, an Australian saying this, but I have been pretty proud of all of the work that the team has managed to do. Maybe to give you a quick sense of what it looks like, what the work just in 12 months has looked like. For our estate, our old estate, it is old, £310 million of additional investment gone in this year to the NHS for climate smart healthcare. Lower carbon buildings, better insulation, better heating, better lighting, phasing out some of the old outdated forms of heating and powering our hospitals. There are solar panels now on hospitals all across the country. Milton Keynes has 2,500. And I'm going to get this number wrong, but I'm pretty sure Wolverhampton Trust is looking to build around 10,000. They've got a bit of brown land right next door. They think they can power the hospital, yes. They also think that they can provide community energy back. Some of the best examples of anchor institutions, I think, are when you look at the link between healthcare and sustainability. That's our old estate. We have a new estate as well. That new estate has got to improve its emissions as well. And so we have new net zero hospital standards. They are long, they are boring, they are 800 pages long, I think. They're very technical. You can't build a net zero hospital today in 2021. It isn't possible. Don't let someone try and tell you that they can. They're probably just offsetting most of their emissions. But we have a strategy that helps us get from where we are now to where we need to be in 2, 3, 4 years, where we think we can actually pull most of that off. All of those new hospitals, I'm sure you hear about, I'm sure you debate about, they're gonna look net zero, they're gonna look different. And we're gonna get better at building those things. It'll be a little bit more expensive, that's okay, because they will run cheap. That's our estate. 20% of our emissions profile is in medicines. Within that, some of the worst is within some of the most polluting medicines that you might find. I'm talking about some of the inhalers, the F gases that you find there, nitrous anesthetics. That's where the bulk of the problem is. And so that's where we focused our efforts. And we have new incentive schemes for our primary care colleagues, new financial incentives to encourage GPs to work closely with their patients, have a discussion about the kinds of inhalers that patient wants. Make sure that as we do it, we're teaching them more and more about proper inhaler technique, about how to manage their asthma, how to manage their COPD, and swapping over. We've also transitioned away from desflurane, one of the most polluting anesthetic gases you can get. You use it to put a patient to sleep. 1 vial of that thing, roughly the equivalent of burning 354 kilograms of coal. We're moving away for a few reasons, partly because of that, but partly it's just good patient care. We're moving to sevoflurane, isoflurane, and then eventually with the rest of the anesthetic community, moving to total intravenous therapy as well. Buildings, medicine, it's a lot of the core stuff that the NHS does, but what about the transport? What about getting people to and from hospitals, moving our patients, moving our staff? There we've got a few things. Number one, extending some of the contracts, changing some of the regulatory mechanisms. The NHS is going to have a zero emission fleet. I think we are the 3rd largest fleet in the country, maybe behind Royal Mail and behind British Telecom. We think we can get everything there to net zero. 2032 is probably the earliest we can do it. The fun part is it's not really a question. We're not really being politely asked. The government has said, listen, 2030, you can't buy a new diesel, a new petrol car. No more of that nonsense. So the NHS is responding, leading the way, going a little bit further, a little bit faster, but it's something we're quite proud of. It's something that we're excited about because we know, yes, it tackles climate change, but it's also really good for patients' lungs, for their hearts, for their brains. 36,000 people die from air pollution in the United Kingdom every single year. Most of that comes from transport. That stuff's okay. That stuff's easy enough, right? Elon Musk can help with some of that. There are a few problems in transport that no one else will do. No one other than a healthcare system is going to create, I promise you, no one is going to create a zero emission ambulance and a zero emission rapid response vehicle. It's just a really difficult thing. You need a big, big provider to be able to do that. In fact, you need someone who has 120 billion pounds of turnover every year, 1.4 million staff, the NHS, which is why we are particularly excited, particularly pleased, particularly proud to be able to say that we've got the world's first zero emission ambulance up here with me in Glasgow. There's actually 2 in existence. There is one in Birmingham carrying patients right now, today. It's fully electric, runs around, it can do everything it needs to do, works very, very well in urban centers. We need something that covers the entirety of the population. So this thing here is an electric hydrogen hybrid. Runs on electric, it's an electric drivetrain. Up the top there is a hydrogen tank. Gives it a range extension of up to 300 miles. It can do everything it needs to do. It can recharge in a single go. Takes about 90 minutes. About 2 a.m. you can recharge these things. There's 2 in existence at the moment. We got to buy a few more. We got to start testing them out. Give them out to each ambulance trust. It's going to be a big innovation process over the next couple of years. But the second we've cracked that, and the second we think we've got enough of these up and running, we're going to start moving so that the NHS just doesn't purchase non-zero emission ambulances. Why would you do it? It's the old way of doing things. The final thing I'll talk about happening in the last 12 months, I told you about that net zero target 2045, right? That's our entire supply chain. Now the NHS, to be clear, has over 80,000 suppliers from almost every country. It's a big healthcare system, so you can imagine with lots of suppliers, it's incredibly complex. We've been clear. Within the decade, and by within the decade, I specifically mean the 1st of April 2027, the NHS will no longer purchase from any supplier, full stop, that doesn't publicly meet or exceed our commitments. We want to see their plan. We want to see it published on their website. We want to make sure that it's been approved by their board. And then over time, we're going to start assuring our work together. We said that a little while ago. We've provided net zero innovation competitions out to industry to provide that support. We have engagement forums with some of our biggest suppliers. You can imagine it's a complex thing to do, decarbonize a supply chain that big. So we were worried. On Friday just past, 15 of the NHS's largest suppliers in med tech, in pharmaceuticals, logistics, even the people that do the scrubs, do the laundry and make the scrubs for all of the nurses and the pharmacists and the physios and the doctors, came out and said, you know what, this is going to be really tough. Net zero by 2045 across the entirety of our footprint, but we think we can do it. It was quite an exciting little moment, I think, because that's the kind of place where you maybe expect a bit of the pushback. Now, there has been a lot of pushback, but 15 of our largest saying, hey, we think we're able to do it. Emissions roughly the entirety of the country of Belgium. It's an exciting moment for the NHS. So we're doing lots on estates, doing lots with medicines, transport, setting up new teams, right? This no longer can be done just with a small group of thoughtful, committed people. If you want to change the world, you need an army of thoughtful, committed people. And so there are new jobs, 140 net zero medicines teams, net zero ambulance teams, net zero nursing, allied health professionals, doctors. There's a new world order and the whole world is shifting, moving in line. That was 12 months ago. We made that announcement 12 months ago that we have had to work on some of this. About a week ago, we were really proud, cautiously optimistic, but we were able to say the NHS has reduced its emissions in year by 1,260 kilotons. That's the target we were aiming for, a little better than what we were aiming for. Kilotons of carbon doesn't mean a lot to a lot of people. So to put it in context, 1.1 million homes powered in the United Kingdom for an entire year. 1.7 million flights from London to New York. Big numbers. It's really, really exciting stuff. It's transforming the nature of healthcare. It's transforming what it means to be a national health service. We think, we hope with this 12 months and with the next 12 months and the 12 months after that, we are starting to be able to demonstrate that this is not just possible. It's not just good for patients. It's not just good for our bottom line, but it's inevitable. That's it. Thank you. Sorry, I couldn't be there.
Thank you very much. We have time for a few questions. I don't know if anybody is on Zoom and would like to ask a question, please feel free to unmute yourself or type in the chat and I'll read them out. Do we have any questions from the, Mark?
Yeah, Nick, can you hear me?
Yes, I can.
Great, yeah. No, before we started off with discussing single-use items and, you know, the kind of growth in single-use, which has been fueled by convenience, industry love them, of course, and infection control have kind of driven a lot of that. And it is quite difficult to change. A lot of the carbon that we expend is in very complicated single-use items that fly across the world, we use once and then throw away expensively. What can we do about that kind of difficult tripartite conversation between industry, hospitals, infection control, and clinicians? That's 4 people, not 3. Sorry. Yeah.
Oh, and I'm sure if you actually mapped it out, there'd be many more that need to be part of that conversation, right? It's been a long direction of healthcare for quite a while. It's been done agnostic of, right? No one was trying to do harm, but it's been done because we were worried about, and rightfully so, some of those infection control issues. We know that needs to change. That's not a question, but we also know it's complex. The kinds of things I think we can all just get on board with is that we should be manufacturing some of this a little closer to home. Simple, right? We should be doing that. We should be trying to reduce the transport and logistics emissions as they come to and from our sites. We should be moving away from on-site incineration or off-site incineration, certainly moving away from landfill. We need a couple of more innovative ways to manage the waste. I was just messing around with some cool new stuff. Some of you guys might have seen down at Royal Cornwall, they've got it, and I'm sure a few other trusts. They take some of the PPE, single-use PPE, they melt it down. Incredibly hot boxes melted down into, and then remake it into trash pickers. The kids apparently love it and spend a lot of time going and cleaning up the beaches. It's a bit of a conservation program. Those kinds of things, right? Managing the logistics of it, managing the waste of it, we can kind of just all agree on. I think we should just get on with some of that. It gets a little bit more complex when we start to ask questions like, one, should we be using as many of those bits of PPE or the single-use items you're talking about as we currently are? A pandemic is a difficult time to talk about that, but it's worth noting that just before the pandemic, Great Ormond Street Hospital, the Royal College of Nursing, that fantastic Gloves Off campaign, little out of date now that it's 2021, but 2019, they were able to reduce the amount of unnecessary plastic they were consuming by something like 17%, really without even trying. It's really impressive. And then you have to ask about product substitution. Are there other products that would work just as well that we can use instead? And the answer is yes, of course there are. The rest of the world has managed a lot of that. So what's the barrier? The barrier is we need to have a complex conversation. And the barrier is that there are a couple of regulators that we really need to kick into gear. I'm talking about MHRA, but I'm also talking about the FDA and EMA. And I think there's a desperate need for a conversation with those three regulators to start saying, listen, get your act together. The world is moving on. The reason I'm a little hopeful about that is I was at an event just over the weekend with Rachel Levine, Admiral Levine, one of the undersecretaries in the United States. The NHS was the world's first healthcare system to make a net zero commitment. The United States was the second, and Spain in a day or two, if you can keep this to yourself, is about to be the third. Those are three big healthcare systems that I think if we start to kick a little harder, can move some of those regulators.
Thank you.
Thank you very much. Do we have any other questions from the audience or on Zoom? Okay. Well, thank you very much, Nick. We'll let you go back to indoors in the heat and dry around there. Thank you so much for joining us. It's been great to have you on the event.
Of course, and thank you for running the event. Everyone here, I'm sure, is from UCL or around UCL. You have a heck of a lot to be proud of here. The UCL has done an enormous amount of really impressive work supporting the NHS. I can promise you, without the analytics that underpinned this, without the assurance and the academic credibility, it absolutely would not have happened. Huge, huge world-changing stuff. Thanks.
In Glasgow, I was in Manchester for COP events, and I've been speaking to negotiators, head of states, the Prime Minister of Kuwait, all kinds of people, and it's real talk with lots of facts and figures. It's hardcore conversations, you know, either this or that. There's an immense amount of pressure on all the negotiators and all of us on UN Goodwill ambassadors, and I am so proud to be the youngest UN Goodwill ambassador, which comes with a lot of responsibility. So I'm going to start with my story. I was a first year student at UCL back in 2017. I was a fresher. I was here at the Freshers Fair, and I was loving it. The energy, loads of students, about 120 different societies, all kinds of societies, from sports clubs to chess society, cheese society, coffee society. And I was like, wow, they really have student clubs about coffee and cheese. But where's climate? Where's sustainability? The closest thing to sustainability was something called the Green Economy Society, which, as the name suggests, was about green economy careers, not about sustainability, really. And it was one of the smaller societies. So I thought, you know what? I am going to build a society, student club, which is going to be space where we create change. But it's not going to stay as a student club. Within a year, I'm going to upscale it. So I came with big dreams. I wasn't sure whether I was going to achieve it, but I was pushing. And actually, it reminds me of a funny story. I met with Nick as, I think, a second year student. And Nick at that time was just starting to work on health and climate change. He was working for the Lancet and the first publication on health and climate change. And I said to Nick, I'm a student. I know I'm really young. I know I haven't got qualification, but I really, really, really want to help. How can I help? And, you know, he said, I see your energy, but there's just no room for students to work. You know, you need to have X amount of experience to be able to do that. Yes, you know, I'll allow you to come work with us in research. The truth is there is no space at UCL or any other organizations. And that was true. So start meeting with the Camden Council, with Bloomsbury Festival, with all kinds of organizations that you'll see around the Bloomsbury campus. And I started speaking to them. Look, you need to engage the youth, young people, regardless of qualifications, on this, because young people are going to be the people that will experience this reality of climate change. And actually, the people who experience climate change the most aren't even born yet. So you know what? I am here for them, and I'm telling you that I've got fresh knowledge from my books, fresh knowledge from the internet, fresh knowledge from the news, that I can interpret what this means. So I set up the Climate Action Society at UCL, which was a normal student club. And I knew one thing I would struggle with is getting students to come. Even people my age wouldn't come. They would much rather go to sports clubs or parties. So how is it that I make climate action something very, I guess a facade almost, attractive to them? So I thought I need to make climate action a trend. It needs to be cool. It needs to be something someone could say, oh, I'm part of the Climate Action Society, and think, you know what, I'm proud of that. It's really cool. You need to come and do it as well. So I started off with entirely social events. It was, organic products, ethical products, looking at supply chains. It was just socials, a vegetarian, a vegan food supply, going outdoors at a picnic, everyone's walking there, and we're just chatting to people, we're talking to them. Once I get all these people in, about, I think 70 people came to the first event, I think mostly because of free food. Then I hooked them saying, guys, I know you want internships and jobs. You know what, here, we're gonna work with companies to open up jobs in this sector. Because I know my generation, even when we come to university, we want to focus on our studies and we are worried about our future. We want to make a living, we want to create an impact, whatever reason it is, whatever motivation it is. We need something on our resumes, we need an internship, we need a job. And I think all of you must be aware that people my age or people at university are dying to enter the world of finance. They're dying to work at Canary Wharf because they're well-paid jobs. You get lots of perks, but they're not good for the environment. And so I thought, how do I create this buzz and this desperation to work in the sustainability sector? Work with loads of companies, work with NHS as well, public and private sector, with the Department of Business, Energy and Industrial Change at the UK government, work with the United Nations to create lots of paid internships, volunteering opportunities to open up people's minds and to show them that, you know what, you can come and you can have actually sustainable career. This is not going to be a waste of your time. Because let's be real, another problem was that in the sustainability sector, a lot of the opportunities are unpaid. And as much as I want to spend all my time doing pro bono work, I do need to survive. I do need to be able to pay for my cost. 90% of the work that I do is with zero budget. I don't take any money. The 10% that I do take is for essentials. And not everyone can do that. I think I, as well as all of us, come from a position of privilege because we are at UCL. We can access world-class education. We are almost in a bubble because we're not exposed to those stressful, very extreme impacts of climate change. I'm ethnically from Pakistan, and I went for high school for 2 years in Karachi, really urban city. Just 1,000 miles away from me is a desert called Thur. And when I was graduating from high school that year, there was a heat wave. No impact in the city, everyone's fine. They're in air conditioning. Turns out in Thur, 120 people have died. They didn't even have water to drink. They're so close to me yet so far. And I was like, oh my God, I am living in a bubble. What good is my education going to do if I'm not able to help people? Background-wise, I'm a student of medicine. I studied population health sciences at UCL, which was a new degree when it came in 2017. And the reason it was a new degree was because usually it's a more specialized master's level degree. And you know what, I agree with Nick when he said that UCL has done so much in the space of health and climate, and it is so important for the UK government, for NHS, has created waves and waves of change, waves of research that are so crucial. And through my bachelor's alone, it was just 12 of us studying. It was a small course. We never had an experience to be in a big lecture theater. We never used this room. We were always in a small cluster classroom. And this was created because the World Health Organization needed us, the UK government needed us, and the NHS needed us. We studied about how health could be impacted socially, economically, politically, environmentally. And I think if I was studying just medicine, maybe I wouldn't have that exposure because it'd be all about biology and the body and not as much about climate change and health. And this brings me to another story, is that I work with the UCL Faculty of Medical Sciences and Sustainable UCL to ensure that every student at UCL will be able to get involved with sustainability, will be able to get to study sustainability properly, whether it's health effects or whether it's environmental law or it's law for bankers, law for statisticians, anything. What I've been trying to do across the past 4 or 5 years is to individualize climate action. often seems like a far-fetched issue, which global leaders are responsible for. Boris Johnson has a lot to do, and he can actually make some decisions. People older than us have voting power, they have money, they can influence world markets, but I don't, some of us don't. And so how is it that we have some impact? Turns out, you know what? We need to give people, young people, that space to actually comment. And we don't just tokenize them. We don't just say, well done, and that's it. We take that on board and we incorporate that. UCL did that with me. And so UCL launched its new sustainable policy 2 years ago. And I was the one launching it. And it was crazy that I, as a young student, was doing that at the age of 22. And at the same time, I remember when I was launching and I was speaking to everyone on the microphone, I just looked around me and there wasn't much diversity. It was lots of really cool old professors, but there were no women of color. There were no one as young as me. So I spoke to the Chancellor, Michael Arthur, who's now gone now, replaced by Michael Spence. I spoke to the Disability team and I said, we must get people of color. We must get young people. I can't be the only one. And I'm glad that this is happening. At UCL itself, I think every department has a working group in which we get students to speak on it. I see UCL students leading sustainability initiatives, which is really great. And when I do this, and I went on to other universities to create sustainable policy to help them divest from fossil fuels, UCL's already done that, thankfully, with a target of 2030. University of Cambridge is going to do that. KCL is going to do that. LSE is going to do that. So it's a big, big achievement, and I'm so glad to have been involved. But we've still got a lot more to do. And I came across a very striking statistic. About 70% of young people are more fearful about their future than hopeful. This means we're giving young people more reasons to fear than to dream. But that doesn't mean we're not dreaming. That doesn't mean we're not hopeful. It means we're looking that much more desperately. We are desperately trying to think of ways of how we can have an impact in this world. And when I was speaking to lots of students, speaking to my family, the advantage I had was, of course, as a student, I was going to all these events. I met loads of people my age. And I was also had a really good relationship with my professors, with board of directors at UCL. And I was understanding how is it that I can bridge that gap. And when I did that, we were implementing UCL's new sustainable policy, crafting it. And we thought there has to be 3 big branches, right? Number 1, educate. What is the science behind climate change? The funny thing is, when I was doing all this activism work, leading all these climate change campaigns, even I didn't know what the science behind climate change was. There's lots of different facts regarding it. Yes, it's human impact, but what kind of human impact? Which human impact from which country? Because we see Russia, the US, UK polluting the environment. Nothing compared to Bangladesh, Pakistan, but people are dying there, not here. We're okay, we're safe for now. So we had to bridge that gap. The second thing was to advocate. What are the potential solutions? And when we talk about solutions, it's solutions in every sector, right? It's whether it's mathematics, whether it's classics, whether it's arts, whether it's community, whether it's interior designing, it's architecture. I went to the School of Bartlett with this, and I said, you guys need to make sure that we're teaching incoming architecture students how to build sustainable buildings, net zero buildings. This is the future. You can't give them an option. It has to happen, even if your country or even if the place they hail from don't consider it important. We must place importance on this. And when an institution does this, especially in an educational institution, we are nurturing responsible global citizens. I went then to schools, primary schools and secondary schools, with a few professors at UCL. We came up with a coloring booklet for primary school children. And as they color different things in that booklet, they're learning about climate change. And we need that. We're not giving them all the climate science facts, but we're kind of instilling that there is something wrong with the way we're living. All of us, we can make a difference. And when I go for talks, I personally tell people, to this day, I really struggle to live a net zero life. I still struggle and debate the daily choices. Am I taking a train down from Leeds to London? How often am I traveling? My parents live abroad in a different country. How often can I visit them? You know, I'm on one hand, I desperately want to see them as often as I could, but on the other hand, I have to be a good example. I could get away with it, but I don't want to. That's not the kind of life I want to live. And lastly, acting. How can we adapt to an already changing climate? The truth is, climate change is here. It's not going to come in 2030. It's not going to come in 2050 or 60. It's already here. We're seeing it in different ways, whether it's heat waves in Spain, in Belgium, and wildfires in California, hurricanes across the world, in Australia as well. It's astonishing. Weather patterns have become more erratic, more unpredictable. Why is that? Rainfall has become strange. Sometimes there's an outburst of rain, and sometimes when it's supposed to rain, it doesn't rain at all. Lands are barren, and the kind of nutrients that you'll now find in soil are no longer nourishment for the plants. It's because of climate change. It's going in our bodies, it's going in the soil, it's in the air. And when I think about acting for climate change, I think, again, relating back to what Nick said, climate crisis is a health crisis. That is the most important thing. And I think that is what's going to get people to act. I think that is the biggest fear factor presently in all the leaders at COP. When I met the Prime Minister of Kuwait, when I met Rishi Sunak, they were concerned that's going to affect the health of people. That's why they're acting faster. Because let's be real, they are more concerned about how socioeconomically viable is their country. Are the supply chains making good money? Without good money, they're not able to make any action. So it's at the same time, we have to understand how difficult it can be for an institution to make that change. I came to UCL in 2017, but apparently there was an organization called Fossil Free UCL, which you all might have heard of, that was fighting UCL, putting pressure for 7 years to get them to divest, but it didn't work. And the reason I did a bit of research around them, I realized that the kind of action that they were taking was passive aggressive. It was pushing people away. It was pushing UCL away because whether it's board of directors or the chancellor, they were fearful. What are these young people going to do? They're really emotional. They don't understand how hard it is to run an institution. And at UCL, our primary focus is educating people, not to be a climate leader. So when we came in with the Climate Action Society, we were bridging that gap with something called climate diplomacy. That is having conversations with a positive outcome, but understanding each of those objectives and understanding timelines. And the result of that, UCL is divesting from fossil fuels. The result of that, the UK Parliament has declared a climate emergency. So I think I'm going to keep it short and sweet. All of us have to reflect back on individualizing SDGs, not just climate action, but whether it's helping uplift poverty, providing education to more and more people. It's a day and age of social media. Let's use the social media for, yes, our personal life, but as well as for spreading any good influences, any good initiative that you see around. I think personally at UCL, we're surrounded by such intelligent and impactful people. Everyone is doing things in their personal and professional life that are inspiring, whether it's getting involved with a campaign, organizing a society event, getting involved with sustainability, giving some charity. We need to pick up from these stories, stop being harsh on people. The people we need to be harsh on are the corporates and the government, and we're going to continue doing that. There is room for understanding, but there's always a balance. And I think with that, I would like to end. Thank you so much for having me today. Yeah, sure, please.
Do you have a question from the room? We go back on Zoom and check.
Yeah.
I'll get you started with a question. I'd like to say first, thank you very much. I have to say that I admire a person who's, I hate to say it, but half my age, has already done so much and with such confidence. It's amazing. So my question is, how do we make more people engaged in such an understanding where you really explained so clearly that it's not about going sort of face first and frontally attacking others.
Yeah.
How do I, in my teaching or in my everyday life, enable more of the students I work with to be more like you?
Mm-hmm. I think summary answer is see them and hear them. But it's a process, right? You see students and you need to build one-on-one relationships with them. And I understand it's hard, especially at UCL when for example, the economics course, the Bachelor of Economics, you get 300 students in there. How do you build individual relationship with 300 students? So I think every professor, every staff member at UCL, every senior student as well. I'm a senior student now. I should, help out any juniors who come in. To this day, I get messages from people who are just beginning to study at UCL, and they get in touch with me. You're really inspiring alumni. How can I do X, Y, Z? And I make sure to reply to them more than I reply to the government or any of the other work commitments, because they need us. They need our attention and our care and our help. And we need to tell them and accept, yes, you know what? You probably won't come into a position of power. I was really lucky. It took me a lot of hard work, time, and effort, but you don't need a position of power. Just start doing what you want to, right? And we will give you the resources to do that. I think the single biggest thing that we give them as professors and as faculty is the education we provide them. We need to make sure that they can actually absorb it. They don't have to self-study, especially in big courses, especially with COVID. It is a big challenge. But when we can focus on ensuring that they are using that education to learn and assimilate it rather than to just learn and pass their exams, they will become confident people. Also make this education more interactive. It shouldn't, yes, it should be about your curriculum, but it shouldn't just reduce to that. How do you apply it in real life and sustainability? Thank you.
Thank you very much. Thank you.
I'll take any other questions. Nothing here so far.
What's the next campus campaign? So you've just invested in fossil fuels.
Yes.
Great. Vegetarian is now standard for all
Mhm.
UCL meals. Well done, that's just brilliant.
Yes.
What's next?
So we have 4 specific KPIs. Number 1, which I think is going to be quite hard to achieve, is 20% waste reduction per person on campus. That means faculty, students, we don't know where the students will come from, we don't know their financial position, can faculty members afford it? We have to be real, we know that financial implications were quite devastating with COVID. We still have to pay salaries, and when we're asking for 20% reduction, what does that imply for people? What are going to be the costs and benefits? Yes, it's going to help UCL, but how's it going to help the individual? Is it practical for them to actually walk every day? Maybe it's not. And so we're coming up with an online system where you can actually log on how you are choosing to get rid of the 20% waste. It could be at UCL or otherwise. And we're testing this with the Climate Action Society. We've got 8,000 members worldwide, which is great. So we've told them, look, no pressure, but we want to see how you're doing that. Is it by reducing the number of flights you're taking? Is it by reducing the number of clothes you're buying? Is it by reducing the number of times you go for dinner outside and not have a chicken or meat meal? The second thing is getting involved with sustainability initiatives in terms of working groups. So UCL has ensured that it's not just Sustainable UCL, which is the main department that deals with sustainability, but every academic department, whether it's the Bartlett or the Faculty of Medical Sciences, we've got working groups, and they meet monthly to track the progress of their transition to net zero or the transition to becoming more sustainable, feedbacking from students and staff about what practices they can improve. The third thing is some ongoing campaigns called Wild Bloomsbury. And Wild Bloomsbury is essentially recreating green spaces. And when we say green spaces, not just for people to come and chill there, but it's actually for planting trees and flowering plants that will be beneficial to offset carbon at a much higher pace than they normally would. Euston Road, where our campus is, one of the most polluted roads across the world. And I distinctly remember when I would come here every day, and I'd come from somewhere in the outskirts, and I would feel that there's something wrong in there. It's something smelly. I can feel my nose getting blocked. It smells a bit strange. All I could smell was petrol and diesel and fuel. So it's great that, we're going to reduce that. It's great to see that the cabinet councils work to pedestrianize most of the streets here. And the last thing is encouraging more accessibility and affordability in terms of sustainable choices, whether it's returning vegan meals, reducing their prices, getting bicycles with discounts for students. You get your bike stolen, you can work with the cabinet council to retreat for free or replace it for free. What they do is they get old bicycles from the dump, they repair it, and they give it to you. So you don't need to waste your money on that. So I think making it accessible and affordable is one of the bigger initiatives. At the same time, we've got lots of challenges ahead of us.
Thank you.
Thank you.
Martin Farley. I'm from the sustainability team at UCL. I'm going to try to keep this quick. I thought instead of just reading out some stats to you, I would give you some quiz questions. And some of you who have seen me speak might be familiar with these, but just to start, lab plastics were estimated to contribute what percentage to the total global plastic waste in 2014? Most of the plastics that we produce in medicine and science don't go to get recycled or go into a floating island of Pacific trash. They get incinerated at high temperatures. Most of those incineration plants, as you might imagine, are not in affluent neighborhoods and have been, or there's some increasing data showing that they contribute to health issues. Anyways, the answer is 1.8%. A new ultra low temperature freezer. So you probably, in medicine, well, everybody knows about these now since Pfizer needed a lot of them, but minus 80 freezers, ultra low temperature freezers, use as much energy in a year as, I'm going to tell you, it's the average UK household. So they can use as much as 2 households actually, in terms of energy consumption. So it's a ton of energy going for our cold storage. A fume cupboard uses, I'm just going to tell you this one for time, sorry. What piece of standard lab equipment uses most energy? In fume cupboards, they use around 2 to 3 houses worth of energy per fume cupboard. And if they get down to 2 in terms of how people use them typically, and also how we set them up. How much does scientific output grow by every year? So this is kind of just highlighting the rate of growth of science, which is pretty crazy. There was a statistic I heard, I haven't checked it, but it said that 90% of all the researchers ever alive are alive today. So just to give you an idea, that the volume of science going on right now is immense, and it's only growing. They put that, this is in 2014, the answer was 8 to 9%, and that gives a doubling time if you are a very astute mathematician of just 9 years. I actually don't know the answer to this one, but this is kind of a more thought-provoking one around science, which is what percentage of all the science that gets conducted is shared widely or is accessible or is even reproducible if we want to be tough. So you might have come across the crisis of reproducibility. Most people, when I ask this question, give the answer around 20% or so. And I just want to highlight, I don't think we know the total carbon emissions of science. I don't think we know them of medicine, albeit we do know the NHS. Maybe I'm wrong on the medicine, but in science, I don't think we know. We know it's around 2% of the world's GDP, just under that or so, and trying to it's actually growing quicker than the global economy as well. So it will continue to grow as a percentage of the GDP. So labs are these energy resource intensive spaces. At UCL, they're using around 52% of our energy. And so they're a big part of our discussion around environmental sustainability. But they're not just a big part of the energy discussion. If there's one thing that you can get out of this is that is to differentiate between energy and carbon emissions. Carbon emissions is really our statistic of sustainability. It's the one that you hear about in the news everywhere. It's what we discuss. It's always around tons of CO2. Energy is the one that we're familiar with because we pay our energy bills at home and we see how much it costs every day to use our energy, and it's easily quantified. It's much more easily quantified than our carbon emissions. But our greater impacts are in terms of our carbon emissions is more than just our energy. At UCL, you can see that our energy consumption during the pandemic years is around 12%. Overall carbon emissions is all the stuff that we buy. So that's all the materials that we use. But it's really hard to know how to be sustainable around these things. Often when you hear about targets around carbon emissions, they're usually focusing on this slice here, local consumption. And all the products that we buy, you might hear the scopes 1, 2, and 3 of carbon. Stuff we buy is more related to scope 3, and that's not always included in targets. And you can see why. We can barely quantify it, let alone reduce it. It's a really tough area to take action in. When you buy a can of Coke, everybody tells you about the sugar that's in it, but nobody tells you about the carbon emissions that went into producing that can of Coke. Or whatever it is that you're buying. Same goes with any medical materials or lab equipment. And so it's really hard to know where to take action. There's lots of green initiatives now that market themselves as green, and the word green is unregulated. So we have a lot of stuff that gets very confusing. Trying to go quickly, there's tons going on around sustainable labs though. So there's more efforts going on. There's green lab programs, there's national networks, there's consultancies, there's even a podcast now called The Caring Scientist. So there's more going on around it. And there's these net zero targets. So net zero 2050 for the UK. UKRI has set a net zero target for 2040, which is fantastic. And UCL, we have our 2030 target as well. And of course, what do we, in those net zero targets, we're talking about net zero carbon emissions. That's the metric that we're really focusing on. We're not saying net zero kilowatt hours or pounds paid for energy. We're saying carbon emissions. What I would say is that, no matter what your net zero target is, the tough part is getting there. The easy part is setting the targets, even though that's not always the easiest, admittedly. And I'm not trying to make it sound too easy, but I'm saying that the real tough next steps for us are how are we going to achieve these targets? And the comparison I'll use is, I've got Athena Swan up there in terms of promoting gender equality in the sciences, but I think the best, most applicable or easily grasped example is health and safety, which is that when we wanted science to be safer, we didn't tell every institution and lab to go invent their own safety standards. It's the same in medicine. We didn't tell everybody to go invent their own standard. We said, here's a standard. This is how to be safe. Work towards it. Assess yourself against that standard, improve against your standard, implement and achieve a culture of safety locally so that we can be sure that everything that we're doing in medicine and science is safe. And that is exactly what I would say we need around sustainability. We need standards. We're short of time right now. We can't wait for people to discover how to be, sustainable. We know a lot of ways that we need to be more sustainable. We know where all the heavy hotspots are for the most part in terms of carbon emissions, and we know what we can do in a lot of these spaces. Which is why, at least around labs, we produce something called LEAF, which is a standard around sustainable lab operations. So it's trying to put into a friendly standard all the ways that you can be sustainable in those spaces in a standardized fashion, broken up in a bronze, silver, gold. It's got criteria in the areas you might expect, but also some of the research quality in recognition that reproducible and accessible science is more sustainable science for all the resources that we put into it. LEAF is a user-led initiative, and so we're not being funded by the manufacturers that are producing the materials coming in, although we acknowledge when somebody does good. We've got calculators in LEAF that can help quantify the total consumption, which is really important because when you can quantify, you can start to see, scientists like to quantify. I just, a lot of thought went into this LEAF process in terms of, balancing the amount of administration. When you have too little administration in a scheme like this, people don't take it seriously. If you have too much, it becomes too hard, and people don't want to do it. And there's all these things that have gone into the consideration for our process behind LEAF, and it's gone really well. We've had all this uptake and etc. And we've actually had, I need to update this slide. There's 50 institutions that have signed up, and international partners around the world now are starting to use the program, and it's gone well. And there's just been this really big appetite, I think, for people working in specialist environments to have some guidance. Everybody in labs for the most part is on side and says, we want to make science more sustainable. What do we do? Tell us what we can do and let us get on with our work, and I'm going to skip these. These are just showing you what LEAF looks like. But what I'm trying to get to is to lead into the work that we're doing with the medical community, because I think the analogy is there that they're very similar communities. It's specialist environments that work around highly resource intensive spaces that need guidance or want guidance on how to be more sustainable. We're dealing with an audience of people that really want to take action here and are seeking support in doing this. And for those of us who work around sustainability, and even those of us who don't, that's what we need to do now. NHS has set this fantastic target of net zero. What does that mean for the specialist areas in medicine? There's more going on, and I'm going to use emergency medicine as an example because this is an area that I'm doing some work it's outside of UCL, but we're working alongside, and we're on the same side. There was some work that was going on around emergency medicine, and these are some fantastic doctors that I work with here, and they had done a little piece around this, highlighting this. But again, I think the example goes is that, and I've seen this occurring somewhat in surgery and some other practices, that there's all these fantastic initiatives going on, which is great. And what we're recommending, though, is that there's standards now, is that there's frameworks and guidance to bring together all of this good practice so that all the doctors and nurses and people working in, for example, in an emergency department and A&E know exactly what to do to be sustainable so that they can do it and move on. So what we've been doing with the emergency departments is similar to LEAF, is that we set criteria, we provided guidance, and we've created sort of a framework. And this framework is broken up into bronze, silver, gold. And we've just started a pilot now. We've signed up around 7 or 8 trusts to pilot this. And it's essentially a standard in sustainable emergency department or A&E operations. The idea is that we will, and we're engaging Greener NHS around this, is that essentially, you know, if we can create a pilot, a framework in this, and it's tried and tested, we can provide guidance to go along with it, then we can give this to other NHS trusts, emergency departments, and give them a quick and easy guide on how to be as sustainable as possible. You know, I'm going to leave it at that because I don't want to take up too much time, but, you know, this is where we're at really with this program, is that, you know, LEAF is a lot further along, but the EDs, we've got a great group together. We're supported by the Royal College of Emergency Medicine, and we've got this group and the sustainability group, a few fantastic folks that are helping there. We've got our framework about ready, and we're about to start piloting it. We've started actually piloting it now, and we're hoping to have results in the next sort of 8 to 10 months, and hopefully Greener NHS will love what we've produced, and it'll be a fantastic resource for other emergency departments as they embark on their sustainability efforts. Looking at other specialist areas in this, and that's kind of the end of my talk, is I just wanted to say thank you for everybody. If you're interested in Greedy D, you can find it on Twitter. We've got an email now, and you can find those things, but that is it from myself. Thank you.
Thank you very much, Martin. Let's see if we have any questions from the audience. I'd like to start you with one question. I follow the Green ED work that you've done, and we've talked about trying to transfer this to other specialties. So you have an audience, not just the people here and on Zoom, but this is recorded as well. So which other specialties of medicine would you like to hear from within UCL? You know, this is a Faculty of Medical Science. What's your message? Who else should engage with you to create a similar standards for other specialties?
Well, the one we're looking at right now is surgery. That's the one we've just started to have a quick look at. And what I did want to say, though, is just it's kind of like every specialty. It doesn't need to be through us necessarily. You know, every specialty, I think, is looking for guidance around these areas. You know, simplified, helpful guidance on how to be sustainable in the areas that all of your students are going to work are really specialty challenging areas. It's tough to be sustainable in these spaces. So it's kind of a challenge is to consider these units that you're working, and it might not be limited to surgery. It's just to think about, you know, how can we, the last thing I wanted to say is the reason that we're focusing on these standards is about continuity. If I were to push in a sustainability initiative and it would rely on me, then it's only going to last so long. But if we can get standards and frameworks in, it's about providing the continuity so that these things last. And so that's why I would encourage people to consider, do your projects, but also think about how they last. Are they going to stay wrapped up in a framework or a program that lasts beyond your time? And that's why we're taking this framework approach.
Yeah, that's great. Thank you very much.
And thank you for inviting me. It's a real honor to be here at UCL as somebody who's not actually from UCL. I am a medical doctor. I was a GP for a long time, and then I was teaching medical students, and I found that they weren't being taught about climate change or sustainability. I was trying to get into the curriculum, and that wasn't happening. And so I went off and did a postgraduate degree in environmental science and policy at Imperial, at their most renowned, in fact, I think it's the oldest course on that globally. And at the same time, the GMC was bringing out outcomes for graduates with the word sustainability in it, which we've been hoping to get into there for a long time at the Centre for Sustainable Healthcare, because I was with the Centre for the Educational Network, and we've been trying for that for a long time. So I will tell you about what's been going on with all of that. So I am involved internationally and nationally in embedding sustainability into the curriculum and including planetary health. So I'd like to start with the AMY consensus statement, which is international, deliberately interprofessional and also non-hierarchical. And it took a year in the making, and I led a team of authors. We included on purpose occupational therapists, dentists, physiotherapists, psychologists, doctors, nurses, obviously. It was non-hierarchical. We had everybody from deans to medical students. And we tried to get a consensus of what it is that we're going to try and get health professions education to say about planetary health. And you can see here that and the consensus statement gives suggestions for how to put this into the curriculum, and also some suggestions for how to embed this into assessment. And you can see in the graphic on the left that education for sustainable healthcare is embedded within planetary health. And this reflects the strong sustainability model, where society, people are a part of nature and not separate from nature. And the economy is a construct of society, so that we can't swap out the environment and people for the sake of the economy. So I defined sustainable healthcare, and this was adopted by AMY, the International Association for Medical Education. And you can see that sustainable healthcare is actually good medical practice. It's doing what's good for the patients and what's good for the healthcare system, but also what's good for the planet at the same time, and delivering high quality healthcare now and making it possible to have high quality healthcare in the future. So outcomes for graduates came out with sustainable healthcare in there, and you can see the word must. The GMC uses must when it's mandatory, it's not an optional thing. So newly qualified doctors must be able to apply the principles, methods, and knowledge of sustainable healthcare to medical practice. And from 2020, medical schools had to show how they were implementing this teaching. And from my research, I published this publication, and what I did was I interviewed key stakeholders. I interviewed medical educators from a whole lot of medical schools who were already teaching this of their own input, because it wasn't mandatory at the time. And I also did document analysis, which I'll go into some technical detail for those who are interested. So with the document analysis, for instance, in this section on health promotion and illness prevention, I mapped what was new in outcomes for graduates 2018 against what was there before. So there's this whole new paragraph that's talking about wellness and well-being as a new concept for the GMC. The GMC had never talked about wellness and well-being before. And they talk about the environment, but now they're talking about ecological for the first time. Interestingly, they hadn't talked about immunization before either. So immunization appeared for the first time in 2018. At the bottom there, you can see global changes that may have an effect on local health and well-being. And I came up with recommendations for how to implement this in teaching. So sustainability should be a theme, not a topic. And I think of all the recommendations, this is the most vital. It's not a standalone thing that you can add on. And people say, well, what are we going to take out of our very crowded curriculum in order to put that in? It's not like that at all. It's got to seep into everything that you do. Train the teachers alongside the learners. The teachers actually don't know what to teach because they're not familiar with it themselves. And involve clinicians because students want to know what happens when they actually practice. Avoid duplication. We don't want every single course and every single medical school reinventing the wheel. Use other sources of support. So sustainability managers of local trusts and so forth would be very happy to have students on board. Employ different ways of teaching it. It's not just lecture-based. Embedding assessment, and I'll come back to that later. Demand institutional backing, so the tone from the top is very important. And you have to support emotional resilience, which I'll come to in the next slide. As ever, evaluate what you do. So the emotional responses to climate change. There's a whole field of study on coming to terms with climate change such that you can act on it. So people go through all of these emotions, and if you don't deal with these emotions, if you don't address it, then you're not going to get anywhere. Whoops. That's meant to be slightly different. Here I've mapped the section 25 of outcomes with for graduates against the postgraduate equivalent. And I think you can see sort of that for doctors who've already graduated and are continuing their training, that sustainability is even further emphasized by the GMC. And they have to do things like quality improvement and prioritize the use of resources, but now students have to do that as well. And how do you prioritize the use of resources? Well, this systematic review shows that for every pound that's invested in public health, 14 will be returned to the wider health and social care economy. That makes you wonder why funding for public health has reduced year on year on year. What's going on here? As health professionals, we can actually advocate for changes to this and actually show why it's important and vital. This is a new part of outcomes graduates, which is transformational, dealing with complexity and uncertainty. Recognize how treatment and care can place an additional burden on patients and make decisions to reduce this burden where appropriate, particularly where patients have multiple conditions or are approaching the end of life. If you think about the resources that are put in to care for these people, you have to wonder what it is that you're doing and is it what the patient wants. So for this, the GMC's guidance that came out in September, that came out in September is very helpful for this, because one of the principles of decision-making and consent is Principle 4, you have to find out what matters to patients and you have to tell them about the benefits and the harms and tell the patient that they have the option to take no action. This again is transformational, and you have to, it shows you about the information that you have to give to patients, you have to tell them about uncertainties, prognosis. Again, they repeat the option to take no action, and this is fairly uncommon in medicine, where patients don't often get that option explained to them in clear terms. Recognize the potential consequences of overdiagnosis and overtreatment. Of course, if you're doing too much, it's not sustainable. And the King's Fund has done studies and shows that doing everything that you can to a patient, because the patient's got this particular set of symptoms or this particular diagnosis, isn't the way to go, because the patient's priorities may not be what you understand them to be. You have to have this open communication with them. And it's not just evidence-based medicine that you need to know what the patient wants and what the patient prioritizes. We've heard about the NHS net zero commitment, and we also know that medicines and medical equipment are a major part of the carbon footprint. And you can see on the right-hand side, the two biggest dots are about medicines and chemicals, i.e. prescriptions, pharmaceuticals that you prescribe either in primary care or in the acute setting. So it's really important to not overprescribe, and the government commissioned the chief pharmaceutical officer to find out about reducing overprescribing. And the problems are systemic, and the chief pharmaceutical officer said, we need an ongoing review and a need for ongoing review and deprescribing to be built into the process of prescribing. Now, isn't it astonishing that this needs to be said? What is going on? As healthcare professionals, we can act on this, we can push for this, we can make this happen. It's also cultural things. These are other sections of outcomes for graduates, which I find applicable to sustainable healthcare education. And this is quite technical. Outcomes for graduates came out, and it was very different from the previous version. The priority learning outcomes, or PLOs, developed by the Centre for Sustainable Healthcare was mapped to the 2009 Tomorrow's Doctors, and therefore this is my way of remapping it to the current version. Also, very important, I think, is to address the ethical aspects of sustainable healthcare, so intergenerational justice. What do we do about the environmental harms that we're doing, that the treatment of our patients now is doing to future patients who have not yet arrived in front of us? The human right to access to healthcare, and actually the human right has actually been changed, and it's now the right to health rather than just right to access to healthcare, and that's very, very recent. Labour rights, how come we can afford to have single-use items that are made of surgical grade stainless steel that we open and may not even use at all and then throw it away? Why is it so cheap? It's because it's done by unethical processes of labour, which is happening in other countries that we can't see happening. The burden of care on patients, which I've talked about earlier. Do we have the patients informed consent, and do they prioritize, for instance, length of life over quality of life? And defensive medicine, which I don't have time for, but the more burnt out a doctor is, the more likely that they are to prescribe and admit people and practice defensively. So it was a little bit complicated, the study that I did. And so you see in red the barriers to implementing education for sustainable healthcare, the enablers in the pale green, solutions highlighted in yellow, and the benefits, which are to the healthcare system, to the patients in the community, and obviously to the environment and ecosystems. But here, because this is a faculty session, I'll talk a little bit about faculty development, the lack of knowledgeable educators, and the resistance from the established biomedical model, and the need for faculty development. So I was commissioned to write this faculty development paper for a special issue of Medical Teacher with some international colleagues. I did this, and also I did not only case studies, but some examples of student initiatives and student activities that would help educators in order to embed this into their own curriculum. And this was the first time that the Planetary Health Report Card was actually appeared in a publication. So if you go online and actually look at the electronic paper, then you can see these links and you can actually click on all of the links. But as I say, the Planetary Health Report Card, which initiated in North America, and they've done a pilot year in Canada, in the US, and then in Canada. When it came over to the UK, I helped that to be adapted to the UK educational culture. And each country that the Planetary Health Report Card operates in has a faculty advisor. So I'm the UK faculty advisor. And we're also developing it for nursing. So I've been very happy to be in a couple of the inaugural meetings for nurses to have a nursing Planetary Health Report Card. And it's also getting more and more international. So I introduced Japanese medical schools to the Planetary Health Report Card as well. So going on now, once it's in the curriculum, once students have pushed for this, or once you've got the educators to you know, be a bit more confident about doing this, you also have to assess it. And you need to cater for higher order complex learning. It's not just rote learning things that you can memorize how many people have died of climate change today, because it'll be a different number tomorrow. You have to assess attitudinal change, changes in people's values. What are they going to do when they actually practice in the future? And then what are they going to do about leadership and advocacy? How are they going to lead this change that is so urgent? And of course, we have to comply with GMC guidance. So this is the medical licensing assessment, which is the document produced by the GMC about how this common assessment across all medical schools is going to be applied. So I can see in both the areas of professional knowledge and the clinical and professional capabilities, many ways in which education for sustainable healthcare can be mapped to these. And what's going on now? Well, there's a curriculum in preparation. I know that each medical school has its own different way of assessing graduates and its own curriculum, but we are writing a sustainable healthcare curriculum for the UK that is intended to be applicable to the various types of UK medical schools. We have 6 or 7 so far medical schools contributing to the consultation. There's always room for more. And it's supported by the Medical Schools Council, which is the association of all the medical schools in the UK, and their Education Leads Advisory Group is going to have a look at this and make sure it's user-friendly across all of the UK's medical schools. And that's it for me, so I'll stop there.
Good afternoon. Are we on afternoon yet? Yes, I think we are just about. And hi to everyone online as well. It's a real pleasure to be speaking here today. Hope to keep it short and hopefully sweet as well. Thanks to everyone who's spoken before today. It's really inspiring and fantastic to see the progress and the acceleration in this field, particularly over the last year or two, and the strides that UCL are making as well, particularly the medical school in the last year or so in this area. So I'll just give you a little bit of my background quickly before I dive in. So I graduated from medical school in 2019, and I actually stumbled into the realm of climate and health almost by accident, really. So I graduated obviously from the medical school, and I was pursuing music professionally on the side as well. And actually, unfortunately or fortunately, I'd fallen very unwell in 2019 and lost my voice. And I thought, I'm not one to let the grass grow under my feet. So I thought, okay, how can I do something meaningful in this time? So during that year off, before I started clinical practice, I ended up doing some work, study with Yale University on climate change and health. And at the same time, I got my old medical school bulletin from UCL saying they're looking to start up a student selected component on this. So I got in touch and yeah, very happy to have led this SSC in its inaugural year and seen all the other fantastic work that Deanne and everyone else has been heading up at the medical school. I'm sure they'll tell you about shortly. So I'll just sort of giving you the context now. I'll take you through the core structure of the SSC as well. It was a fantastic year. We only had 6 students. The end number was low, but it gave us a very intimate setting and allowed us to build those one-on-one relationships and really kind of mentor the students over those 8 weeks and sort of the next steps going forward as well. So I think most of the things that I was going to talk about in the background have been covered already, but as you know, there have been updates to the GMC curriculum and there's certain expectations to the medical students having graduating with certain knowledge and applying that in their practice. Also got the new drive initiative, as SanYuMay was telling us, with the Planetary Health Report Card as well, which is almost putting a little bit of pressure across the medical schools to embed and incorporate this into the curriculums. And there are also the GCCHE core competencies that I sort of leaned on for some inspiration for the course structure as well. So obviously there are various ways to include this into the curriculum, and the way in which I set this up was a students selected or a standalone optional module for the medical students. In a way, it's competing with dozens of other established SSCs. So we're asking students to venture into the unknown. But to take you back 8 years ago, when I walked through these doors for the first time, there was very little, if not any, teaching on climate change and health. And actually, pre-medical school, I remember having a lot of climate anxiety even then. I mean, we were introduced to Al Gore's Inconvenient Truth at school, at the age of, I must have been about 12 when I watched that. And I presented for the BBC and the Soil Association and did a lot of work in the natural world realm. And I sort of lost all that because medicine is very streamlined, it's very intensive, and in 6 years, you're expected to cram in a hell of a lot of material, for want of a better way of describing it. And so we were asking students to really, give us their time and interest in an area that was sort of alien to them as well. So the fact that we even got 6 was, a great start, really. So it was a course for first-year medical students, and it was almost like a pilot year, and it's a standalone module. And I'm not going to go over this, but this is a definition that all UCL medical students will be very familiar with. But the key I've highlighted here is it's a constantly changing modern world. Climate change is putting a lot of pressures on healthcare systems around the world. We're not only changing the way in which we operate, as we heard from Nick earlier and all of the speakers so far, but we're expecting them to adapt to a range of different circumstances in terms of threats to the population that they serve as well. And of course, we've heard of that. So it was an 8-week course, 3 hours per week. So it is limited in terms of time here, but I employed sort of a range of different routes of learning, so blended learning. So we had some seminars. There was also group work. So the fact that there were 6 students was fantastic because they got a lot of time to do group discussion. And we had live speakers every week, sometimes 2 speakers. So the key word I was trying to, or the key feel I was trying to bring into the course was empowerment. So I wanted the students to not just feel that they were learning about it, but it's sort of what skills are they going to pick up from these 8 weeks, and how are we actually going to bridge that to them taking this forward after the SSC, and not just saying, okay, I know about climate change and health and I'm concerned about it, or I'm aware about it, but are they going to go forwards and do something meaningful in this field? And of course, we had an assessment at the end, and I've got some really good examples there, just in a few slides. So as I said, these are the basic broad areas that I covered in here. So a lot of these guys wouldn't have studied geography, maybe even at GCSE level, or whatever that's called now. So I wanted to touch a little bit on climate science. We worked with the UCL Department of Geography to produce some good talks at the beginning. Chris really was really instrumental in that at the beginning, just giving him that background and the knowledge there. We then had a couple of sessions on climate and health drivers. So this was sort of the diagram there, which is used very widely in a lot of talks. But I think it's really it's a very broad and very large area, and a lot of material to cover as well. So we had various speakers covering some of those aspects as well. We also worked through adaptation and adaptation strategies as well to the various threats going forward. I think this is really important in piquing their interest in terms of advocacy, but communication as well. So not only understanding it, but how, these guys are going to be pillars of the society going forward, very well respected as well. How are they going to be advocates for change and advising policy going forwards? And I think they found that quite a practical session as well. So we had Professor Chris Rapley doing that session on climate communication, and then some sections on NHS net zero goals, sustainable practice as well. So the global GCCHE is basically the Global Consortium for Climate Change and Health, and they have been around for a while, and they've provided sort of various domains and frameworks which several of the institutions around the world in setting up optional courses have leaned on. So these are some of the realms, or the key realms in their updated list of competencies last year or the year before. So the first area is knowledge and analytical skills, communication and collaboration, policy and advising policy, public health practice competencies, and clinical practice competencies. Obviously, it was beyond the scope of the SSC to cover all of these areas, but the areas we focused on were knowledge and analytical skills, communication as well, and somewhat on public health practice. So this is just about a list of half the speakers that we have. We're actually very lucky to have one of the speakers in this room today. So Aliza very kindly contributed there, and the students absolutely loved the sessions that we had. I picked a range of speakers from around the world in various disciplines as well. So it's really important to have not just medics advising medics or doctors advising doctors, but people from research. There's Joachim Rocklov at the top, Shabir Saha, Cecilia Sorensen, and people from around the world, because I think this point has been made as well. We live in a bubble, particularly in the UK from what I've seen, in that we are not even in the situation that many places in Southern Europe are facing in terms of the burst in terms of migrant crisis and immigrations yet. We're a very privileged bubble as well in London. So I think it's difficult for people to see outside of that bubble. I mean, Lisa was saying even from Karachi to the Thar Desert next door, kilometers away, it's hard to make that jump. So it made a lot of difference having, Prof. Godwell Namo from South Africa, people from Australia, from US who've been experiencing wildfires firsthand, just saying, it's here, it's happening now. These are the threats we're facing, even if it's, psychological impacts of wildfire. This is what the emergency services are dealing with right now. This is not 10 years time, and you guys are going to be dealing with the fallouts of extreme rainfall within the next decade as well. So this is happening now, and I think that hit home really hard to the students. The fact that we also had live sessions was important. I think a lot of other institutions have been recording seminars as well for interests of engaging a wider breadth of students, a number of students, but I actually felt that the Q&A was probably one of the most important take-home parts of the course. The students learned a lot and asked some really fantastic, insightful questions. Just to give you an example, so these students had come in their first years, they were 18 years old. Most of them had actually no background in any understanding of climate, and obviously they're in their first year of medical study as well. They actually produced some fantastic reports, so they were able to, by the end of the course, access the data, which obviously there is a paucity of, but it's growing, and it has been growing in the last few years, access the data, form cohesive arguments, and put stuff together, really fantastic reports. So this is one of the students produced a report on the effects of climate change on the Nuven community in the Arctic as well. We had students looking at the vulnerabilities of women in the Alage community in Nigeria. And then we had students also looking at climate change and affecting, malnutrition in Brighton and Hove, and looking at dietary changes as well, co-benefits. So I felt that they were able to go away and actually think, how can I structure an argument? How can I put something together that could be used to advise somebody? And I thought that was fantastic. Over 8 weeks, with very limited amount of time, their skill set really widened. We also had really good feedback. Obviously, the N number is small here, but the students really enjoyed the course overall. There were no complaints. I think they found it, which is a relief from my side, first year lecturing. So they really loved it, and I think it's a real starting point to show that, okay, medical students are not just, they don't just want to learn about cardiac physiology or respiratory medicine. Obviously that's why they've joined medical school, but this also will pique their interest if it's sold to a wider number of medical students. Challenges, obviously, as I mentioned, uptake for optional modules. I'm competing with established SSEs that have been there for about 15 years, which attract dozens of students. Adding content to a packed curriculum. So obviously this is a standalone module, but the medical school doing some fantastic things, embedding this into learning objectives across the curriculum. There are working groups that have been doing this for the last year, which is fantastic. It's a limited time, 8 weeks, and it was only a one block of the SSE as well, so I didn't even have a chance to do that with 2 sets of medical students. And also, as you can imagine, I'm just 18 months ahead of the students in terms of my knowledge. So, there's a lot of training the trainers going on here simultaneously, and the knowledge constantly needs to be updated as well. So it was a challenge in that respect, and I'm updating everything as I go for this year. But it was very rewarding. So other initiatives, which we're going to hear about afterwards, we're embedding this across years 1 to 6 and their modules, the Planetary Health report card team, and the steering group as well at UCL. So I think just going forwards, the students really, we have 2 blocks of SS student selected component of the medical school. And last year, I think was the first time where they had sort of a mandatory block, the first year students, where they had to have a specific set session that all the students attended each Thursday. And we had one of our sessions during their first block where we had someone from the NHS supply chain called Priya Bailey, who did a session on just introducing the concept of carbon emissions from various parts of the supply chain in the NHS with a quiz. And I think that's the first time many of these students have even considered at their early stage of training, okay, we're talking about, anesthetics, we're talking about plastic, we're talking about transport, and thinking about just emissions across the scope of the chain. So I think the students, and even from the SSE, the feedback was they actually wanted some more practical hands-on advice on how they can bridge this to their sustainable practice going forward. So probably more involvement with the NHS sustainability team, maybe having a session where, people working with Nick can talk to the students directly and have workshops or sessions on how we can make our practice more sustainable. Cross-discipline, so probably recording the seminars, because most of them were not recorded this year, for students to access asynchronously, and sessions on the logistical aspects, as I mentioned. So yeah, hopefully I've not blabbed on for too long, and I'm that grateful to UCL for the opportunity, and hope we can continue the great work. So thank you.
Sustainability in their curriculum in any way they want to, please reach out. And we've had 4 students reaching out to us who worked in 4 different fields and very worked with me. I'm super happy with the idea that we came up with, which was really driven volume. I couldn't have, the thing is when a student comes to you, they're the experts is one thing, which is being students. They can tell you what students are going to engage with most. I would never have come up with an idea like that. And I presented to the students in the first week this year. And I had such positive feedback that the next week the students asked me why my lectures were boring. That was the crushing, I don't know why I'm using these words, but basically the crushing reality of I need to just make all of my lectures as exciting as what Veronique had been able to say. So thank you very much for saying a few words today to us.
Oh, thank you so much. That's really lovely. So I'm going to give a brief overview of the content I covered, as well as how I chose to cover it, because let's see if I can share it properly. Okay, I think that should be fine. So I was tasked with creating content on sustainability within the life cycles of assistive and rehabilitation devices and technologies, but shorter than the title a little bit. And yeah, I want to thank you for the support and also the freedom you gave me in choosing the direction of the content. So I ended up creating 2 different parts. Firstly, just an introduction to sustainability in general, before going more in detail into product design for circular life cycles, when looking at the life cycles of these devices. So the first section, I covered definitions of sustainability, comparing the social, economic, and environmental sustainability and the different visualizations that are used to discuss it, strategies to compare these realms, as well as looking at the relevance of assistive devices and technologies in achieving the SDGs. I managed to find a paper that actually gave an example of a different assistive device or technology for every single one of the SDGs, which was quite interesting and quite relevant, I think. And though I wasn't specifically tasked with creating an introduction to sustainability in this way, I thought it was quite important to sort of stand back and sort of consider briefly what sustainability is and how it's being used. Especially since the next section sort of zeroes in on the environmental aspect to sustainability. I thought it was important to look at it in a more holistic sense and sort of compare these different pillars. It was quite didactic in how I presented it, but one activity was, I know it's the weak sustainability model, but having students brainstorm how products can be impacted or can impact the sustainability of these different realms. And these were some ideas students could come up with. And so this is just to show you how it looked. I created a bunch of videos, but also written content so students could navigate it as they pleased. But I finished it, and as a student last year who had to go through a lot of video content, a lot of written content online, I wanted to be a little more creative in the next section. So I created an interactive infographic, and this is just a screenshot of the main page. And the idea was just to have the main facts and figures sort of nicely presented, but in a way that you could navigate throughout the pages at your own pace. So I started off by detailing the linear life cycle with the take, make, waste models, detailing planned obsolescence with an embedded video. There's a little form at the bottom students can fill in just for a bit of fun. You can compare yourself to your classmates, and examples that I've drawn from within the actual video are linked in either the sources page or additional icons at the bottom. And so I'll just skim through it so you can see how you could go from one page to the other. Yeah, you could also embed it directly within Moodle, which I thought looked quite good, I hope. And sorry, lost the controls. The videos themselves, I tried to make them between 5 to 7 minutes because they say that's the sort of peak level of interest that maintains you can get from students. But for a lot of them, they ended up being 10, 11, 12 minutes. So I think this kind of format works better with bite-sized content and keeping it to 5 minutes. In terms of the content I covered, I was lucky in that I could draw from a lot of knowledge I already gained from my courses and just sort of personal research on the circular economy, circular strategies. But I wanted to find examples and draw on issues that were relevant to assistive and rehabilitation devices. So for example, within the manufacturing section, I take a bit of time to detail the process of 3D printing. The environmental impact of it can be minimized for one-off products or products that need to be custom made, which means there can be less waste. It also enables local production, so less pollution in the distribution stage. But these very qualities also are quite good in making prosthetics. You can customize it to someone's body a lot more easily using 3D scanning. This is actually a 3D scan from a Paralympic cyclist, and the process of doing it this way is faster and cheaper than plaster casting. and also adapting it to someone's personality. At the bottom right is a picture from eNable, which is an open source community that creates and shares open source designs for assistive devices. And I thought it was an important example where the sort of financial costs are being minimized, environmental benefits are being maximized, but also considering the social realm. Another area that I learned from was within the distribution section on packaging. As we've mentioned before, the use of single-use plastics particularly is a huge problem. And so using reusable packaging, reusable products really reduces the impact, the environmental impact a lot. But I came across examples and articles but drawing on the need to, in some situations, it's not the best. It's not the best solution to use reusable products all the time. And a lot of anti-plastic or anti-single-use plastics are not very inclusive in terms of considering how it impacts people with disabilities, which was new for me. So considering alternatives that are inclusive and don't pose a danger to other people was really important to raise. And yes, that's a brief, very quick overview of it all. And so I hope it was nice for the students, the interaction and the choice that I provided, but I also know that for academics out there, like learning how to create an interactive infographic takes a bit of time and might not be the most relatable advice to give, but there are also there's other software that I'm kicking myself a little bit that I didn't try and use within Moodle, the H5P content where you can create interactive videos, branching scenarios, or just other kinds of quizzes. I think you can get the same level of choice and interaction as what I created. So yeah, thank you very much for listening. And if you have any questions, yeah, thank you.
So hello, we are the student leads for the PHRCs, the Planetary report card, which has already been touched upon by SanYuMay and Adesh. And unfortunately, Catherine couldn't be here today, so it's just me and Luisa. My name is Trizzha, and I'm Luisa. And so we're just following the section about the curriculum, and I think one of the things I want to say before I start is that I'm so proud of all of the work that UCL has done, and I'm really proud to be part of this university because I think really the best route to change is through public support, and the best avenue towards that is through education, which is, I think, why it's so important for healthcare professionals and people to understand the health impacts of climate change so that they can be advocates for sustainability. Those in healthcare are in a unique and I think a really important position in the public eye. And if they stand united together in believing that the climate crisis is a health crisis and is the biggest issue that we're facing today, I believe the public will soon follow and also reflect upon how they can maybe be more sustainable in their everyday lives. So yeah, the PHRC, international initiative, and I think it was the first time it was done in the UK last year, and so also the first time obviously that it was done in UCL, and I think Luisa is just going to be saying what happened last year.
Yeah, so as Tricia said, the PHRC report card has come up several times throughout the morning, and we just thought we'd talk to you all. I don't know if you can hear me.
Yeah, you can take them if you want to.
Yeah, if we're all right, that's a bit better. We thought we'd walk you through what the PHRC report card actually is and what we as student leads, kind of like what our role is and what we did last year. So it's been mentioned last year was the first year was actually the report card was actually introduced to the UK, and as student leads we had the role of introducing the report card to the university. We were very lucky that all of the faculty that we came across and like people at the university and the sustainability team at UCL were extremely helpful, welcoming, engaged. And our main goal, as I said, was to prioritise that staff student involvement. And it was only thanks to Professor Mark Emberton who helped us create the PHRC board, but also Diane for your so much help day by day. So what we did was we created the PHRC board, where we have roughly termly meetings, and we just discuss the progress of the report, but also what initiatives we're going to do and take forwards throughout the year. So thanks to Professor Mac Emberton, Diane, as I said, Dr. Faye Gishan as well, who was here earlier, Dr. Anne von Vanhoestenberghe, I'm so sorry, and also Martin Farley and the sustainability team who spoke earlier. So what we thought we'd do is, show you what UCL did specifically. The PHRC report, so the report card is actually a way of evaluating medical schools in 5 broad areas, and within those 5 broad areas, there are what are they called, metrics that we score our medical school from a 0 to 3 point system. The main areas, as you can see here, are planetary health curriculum, interdisciplinary research, community outreach and advocacy, support for student-led planetary health initiatives, which is kind of what we're doing as well, and campus sustainability. That at the top was UCL, and as you can see, we were second in the UK nationally, right after Keele University. So we thought it would be fairer to compare ourselves to London-based medical schools, because for obvious reasons, given our close proximity, and we weren't the best in London, but having said that, we are adamant that we cannot get complacent. We did really well. Overall, we got a B-, and which is a good grade, but forgetting and like putting grades aside, there is so much more that we can do, and having, after this whole morning of talks, we're so inspired and so grateful to be part of this whole movement. And we thought for this year, having set up a PHRC board, having done a report card and kind of evaluated the medical school in all of these areas, we thought we would focus on our worst scoring part, which is the community outreach and advocacy. Just really quickly, for those who don't know, the community outreach and advocacy section of the report card are the metrics that looked at how the students and the medical school collaborated with local communities to promote planetary health and the importance of it. This included collaborations with local charities, as I mentioned, but also education of patients in our hospitals or GP practices, and just teaching the wider community of students and public about planetary health. So more to come, hopefully, throughout the year.
Yeah, so this is what we're doing now and what we're focusing today. Luisa's already touched upon it, partnering with community organisations and also with hopefully Camden Council, again with the education materials and also hospital sustainability. So even though the board that we have is called the PHRC board and it's based on the report card, it's not just going to be what the report card has. We really think that sustainability within hospitals and doing what we can and piloting what we can at the UCLH Trust would be immensely helpful. And if the whole idea of the report card and the whole idea of doing these sort of initiatives is to be able to share ideas and be able to bounce off of people and be able to implement things and go, hey, we did this here, maybe try it this way, this is what we found hard, this is what we found easy to do, and just sharing ideas and sharing resources, and hopefully we can do that and improve with all together. One thing that we haven't mentioned yet is, for example, as an example, is that clinical skills and the waste that occurs there in the medical school, and it's a long time coming and it's quite hard to do with all of the infection control standards, but hopefully this year it's going to be a lot of time for change, and also in the next years coming as well. But thank you for listening, and if there are any questions, and those are our email addresses if you need them.
Thank you very much.
And it's a real pleasure to be here today, and thank you all for speaking. I've learned a lot from everyone. So my name's Flo. I'm a 5th year medic based at the Whittington at the moment in Peds. That's what I'm doing later this afternoon. So I'm here to talk about two student initiatives, the first of which is the Climate Change Sustainability Working Group, which is actually not just a purely student-led initiative. We've had a lot of amazing staff members involved as well, including Deanne. So this group was set up in December of last year, sort of in response really to student concern about climate change and is UCL Medical School doing anything about it? And if so, what should we be doing? So it met a few times over the last year and mainly focused on what sort of curriculum change students wanted and suggested. And we sort of split up into pre-clin and clin groups and basically compiled a report of everyone's suggestions, which was presented to the executive team, MBBS executive team. And there was actually a really, really lovely and fruitful discussion with the executive team about what are feasible changes that can be made and what barriers might exist to, you know, implementation of the ideas. So I think a lot of, I can send out the report if that's helpful for people to see, but you know, a lot of the change actually have been actioned already. A lot of suggestions have been made to module leads about things to include. And I think, you know, barriers that sort of exist are staff time and expertise, which has already been mentioned, but also the curriculum is already really overfull. And I think, Adesh, you've seen that with the SSC, you know, there's so much to learn at medical school and sustainability is important and people haven't quite recognized that. We need to find a way to fit it in. But it's great to hear from SanYuMay about the research that's being done in this area. And, you know, sustainable education is backed by evidence now. So hopefully sort of the group will meet again this year. I hope. It hasn't met yet, but we can sort of see what changes have been implemented. We can sort of have a look at this research that's going on and, you know, how we can make evidence-based suggestions in the future. So the second thing I sort of wanted to report on is a UCL-led climate emergency declaration, which has been amazing to be a part of. So it's basically a declaration that is publicly available on the internet. It raises the issue of the public health problem that's posed by climate change, and it warns the public of such, and also sort of demands better, more ambitious carbon emissions pledges from the government. And we've now had 12 medical schools out of, I think, 30 something officially recognised in the UK sign up to this declaration, which is really exciting. And it's been a big part, UCL has been a big part of that, big advocate, and getting the Medical Schools Council's support as well has been really helpful. So yeah, those are just two sort of exciting developments that I wanted to share with everyone, and hopefully sort of through this meeting and over the course of the year, it sort of can be linked up with all these other initiatives that are going on. So thank you.
Thank you very much.